Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello everyone, I am Dr. Shital from THIP Media and today we are here to have a discussion on IUI or intrauterine insemination. IUI plays a vital role in modern fertility treatment by offering a middle ground between natural conception and a more intensive assisted reproductive technology, catering to the diverse needs and preferences of couples and individuals facing fertility challenges. To gain knowledge about this, we have with us Dr. Shital Punjabi. She's an accomplished IVF specialist with more than 25 years of experience in gynecology. Currently, she's the founding director of Shashwat IVF Center and the IVF Department at Motherhood Women's Hospital. She is also a renowned consultant in cosmetic gynecology and has assisted over 10,000 childless couples and conducted numerous deliveries and gynec laparoscopy surgeries. So, let's get going without further ado. Hello, Dr. Shital. Welcome to THIP Media.
Hi, thank you for welcome.
Yeah, okay. So there is a lot of curiosity about IUI procedure or intrauterine insemination. So could you please tell us how is IUI performed and what is the timing of the procedure?
See, IUI is basically a kind of assisted reproductive technology which we offer to young couples married since just 2 to 3 years and having both the fallopian tubes open and with a near normal, moderately normal semen examination report. And usually we do IUI on the day of the ovulation once we confirm with the ultrasonography and blood report that she has ovulated and now she is in her fertile period. So usually it is between 12th day to 16th day of the period of a female. So that time we are doing IUI.
In general, what is the success rate of this procedure and are there any factors which can be related to its failure?
Yeah, success is like around 10 to 15% per attempt of IUI. Like that. Now the criteria is if the egg quality is good, if she doesn't have any major hormonal dysfunction, if the female has a good functioning for fallopian tubes, her uterine blood circulation and uterus जो बच्चादानी जो बोलते हैं या womb बोलते हैं उसकी the inner lining which is known as endometrium वो अगर नॉर्मल है एंड हस्बैंड के स्पर्म के पैरामीटर बिल्कुल ही खराब नहीं है लाइक मिडल में है तो देन देयर आर गुड चांसेस ऑफ प्रेगनेंसी तो उसके लिए 3 मेजर फैक्टर्स जैसे मैंने बोले एक द क्वालिटी ऑफ द एग सेकंड द क्वालिटी ऑफ द स्पर्म एंड थर्ड द वर्क ऑफ द fallopian tube. These are the 3 major reasons which affects the pregnancy rate per IUI attempt.
Like you said, there are several factors involved. Are there any chances of multiple pregnancies with IUI and how is this risk mitigated?
See, in IUI, what we usually do is we give some ovulation induction agents. We call it controlled ovarian hyperstimulation. So, in some couples, the female is given tablets for superovulation. In few females, we give injection, that is injection gonadotropin, जो अंडा बनाने का इंजेक्शन जो बोलते हैं वो दिया हुआ होता है. तो नॉर्मली जो एक बनने की बजाय in IUI cycle, usually we get 2 to 4 eggs from the female. So there are increased chances of twins in IUI. अब twins होता है तो like around 100 IUI success couples है उसमें से 4 to 8 का twins होता है. तो incidence is around 4 couples in 100 couples of successful IUI. Now, if you want to reduce the chances of twins pregnancy, then we can select the protocol for ovulation. तो जो फीमेल को हम मेडिसिन इंजेक्शन देते हैं फॉर ओव्यूलेशन इंडक्शन ओव्यूलेशन ऑगमेंटेशन तो वो उसके हाइट वेट उसकी एज उसकी ओवरी का वॉल्यूम उसका एक सीधा VMH रिपोर्ट है वो देख के सिर्फ एक के बदले 2 एग बने या मैक्स 3 एग बने ऐसे उसको सॉफ्ट प्रोटोकॉल दे सकते हैं जिसकी वजह से शी डजंट प्रोड्यूस मेनी एग्स and then we can we can mitigate the risk of multiple pregnancy in that.
Since you just mentioned there are a lot of medicines involved which are given to the women, so could you please elaborate on that, like which are the medications involved in the IUI process?
Letrozole is one tablet which is available and which is being used for ovulation induction across the world. Depending on the age and weight and height, like BMI of the female, the dose is decided. Most of the times it is being started from the third day of the menstrual cycle to approximately 5 days, or sometimes extended up to 10 days also. So that is a one molecule which has been giving consistent result in almost all females. Second preferred molecule is clomiphene citrate. That also we are giving, and that also has proven good results in superovulation. In certain patients who have suffered from PCOD, endometriosis, or their age is more, or their fertility index is relatively low, so then in those patients we add gonadotropins also. In gonadotropins, there are two major variants. One is purified FSH, and the other is FSH plus LH. We call it menopausal, human menopausal gonadotropin, HMG. अब वो प्रीफर लाइक हर एक डॉक्टर के प्रेफरेंस के ऊपर डिपेंड करता है कि वो FSH यूज करेंगे या फिर FSH प्लस LH कॉम्बिनेशन यूज करेंगे. बट IUI में यूजुअली the data across world has suggested that FSH plus little amount of LH, which is physiological, that gives better results. Yeah.
Okay. Okay. Since we now know that there are a lot of
the patients, yeah, let me just extend a little, like, which probably will be helpful to our patients out there. In some patients, there are thyroid disorder, then we give thyroid supplement. In few patients, they have high prolactin, then we give antiprolactin medications. So, ये सारी adjuvant treatment होती है, but the main treatment, what we call controlled ovarian hyperstimulation, letrozole, clomiphene citrate, and gonadotropin. These are the major things which we use.
Since now we know that there are a lot of medicines involved, there are a lot of different treatment approaches here. So, are there any lifestyle changes or precautions which are needed while or before undergoing an IUI procedure?
Yeah, I would definitely suggest, because to optimize the results in IUI, if a couple, like, they take a good amount of folic acid, B12, at least minimum 3 months prior to the plan for their pregnancy, it increases our chances of success per IUI attempt. That is one thing. Second, if ovary is good and normal, nothing to worry. But if ovaries are like relatively older or aged or relatively exhausted of the number of the eggs, then the antioxidants and the micronutrients for the ovary, and sometimes DHA, that is a substrate which is required for most so many patients of 35 years plus age. So unke liye, like, giving 3 months of the pre-treatment before going for IUI increases our chances of success. That is there for female. Now for male also it is like that. If the male is smoking or like consuming alcohol or something, then they can reduce on that, and they can take antioxidants, which helps in better semen parameters and better sperm qualities and better fertility index of the sperm. So that is important. For lifestyle changes, both of them should be like, calm, cool. So they must be doing some good meditation or something for a pretty long period of time. Then it increases the chances of pregnancy per attempt. If a female or male, either of them is like overweight, then they can work on their weight first, and then that weight, like, either reduce the weight, particularly in those obese females and having PCODs. So in them, we always advise that, like, reduce your weight by at least minimum 10%, and that will increase our chances of IUI minimally by 100%. So that is there. So these are few of the things I would advise. And one more important thing is there are multiple disorders in the female reproductive tract. So many times we have seen that female has suffered from urinary tract infection or vaginal infection earlier. Then we give them the antibiotics, and we ask them to get their fallopian tube patency test to be done, which can be done with the sonosalpingography or histosalpingography, and sometimes we need to do diagnostic laparoscopy also for the fallopian tube patency test. So these are in investigations and the protocols we ask them to follow. And it is always customized. It is always individualized. It's not that the same advice will be followed by everybody. But basic lifestyle changes, basic dietary advices, basic micronutrition, the antioxidants, this helps in all the patients.
So now that we know the precautions and the lifestyle changes, are there any potential risk or complication associated with the IUI procedure?
Very good question. Actually, everybody must know this, that all the medical procedures, they have, the way they are like beneficial, they have their own risk also. If they are being used judiciously in the right hands, with the right treatment protocols, and with the nice, best practices, best IUI practices in the embryology lab, if that is being followed, then no worries. Otherwise, if we'll start one by one. If we have given very high dosage of gonadotropins, or we have given very high dosage of ovulation induction agents, then it may result into multiple XL actions, which may result into ovarian hyperstimulation syndrome. It may result into multiple pregnancy, all these things. Second, if the patient is not given the antibiotics and all, and particularly in the male factor, and if there is infection present in the semen, then during IUI procedure, as we are putting the cannula inside the uterus, तो वो जो cervix होता है, mouth of the uterus जिसको बोलते हैं, now वो cervix is fighting against infection. Now we have bypassed the cervix and put the semen, separate QA sperms inside the uterus. And if the antibiotic is not given, or the embryology lab has not taken a stringent protocols for completely aseptic preparation of the sperms, so then we may introduce infection directly inside the uterus, right? Third, while insertion of the IUI cannula, if the aseptic measures are not taken, then again, we are introducing the infection inside the uterus. And I tell you, I have been practicing since 27 years, and I have seen so many patients कि जिनको IUI के बाद में अंदर infection हुआ हो, and then few of the patients I've seen कि जिनको जो दो साइड में fallopian tube होती है, वो fallopian tube में pus collection होके pyosalpinx होता है, and then immediately the pyosalpinx and then pelvic inflammatory disease, and then there is septic collection of the pus inside the peritoneal cavity happens, and then except surgical drainage of that, which is to be done by laparoscopy, there are no other chances that she would recover from that infection. So we have to drain that first, and that's why fully aseptic precautions and all the protocols, all the best IUI practices are to be followed. Otherwise, that results into bilateral tubal block, or we have to remove the tubes, and then the only alternative the female is left with is compulsorily going for IVF. So very, very important. We cannot do IUI just like that anywhere or in any laboratory. The semen is being prepared or cultured or whatever we call it as for insemination. We are putting directly inside uterus. We have to be extremely careful.
So now that we know there are several steps involved, right from the collection to, the sterilization, maintaining everything. So what is the typical cost of the IUI procedure, and what does the cost include?
Okay. See, in IUI, there are two things. One is preparation of the female. That is controlled ovarian hyperstimulation. So either tablets or injection, what is being given to her for superovulation. So that is the cost of the medicines and injections and all. And second cost is IUI procedure per se, which is to be done in embryology lab in any women's hospital or the primary care infertility center, right? So that is the lab cost. In lab, the lab instruments, the scientist who prepares the semen, and third is the media which is being used for semen preparation. So in that, a media is being used from semen to take out the sperms, then from sperms to take out the best quality sperms, and then from those sperms to actually activate those sperms, right? That is a complete process. That process is done in embryology lab. So that is the expenditure. So if only the process, embryology lab, if embryology lab procedures we consider, then the cost lies between 8,000 to 15,000, depends on the the CT where it is being done. This is I'm talking about in India, and the injection or ovulation agents, they may range from 500 rupees to 5,000 rupees. Depends on the pathology, what dose is being required for that particular female to produce the good quality of the egg. Third thing is the serial sonography is being done. When like we give any ovulation induction agent, we have to do a sonography of the female from ninth day of her period till she ovulates. So 2 to 3 times the female has to go to either radiologist who does the sonography or a gynecologist, and she gets her ultrasonography done for checking both the ovaries and uterus and the number of the eggs, the size of the eggs, the Doppler study of the egg for the blood circulation. So this is the third expenditure, and that varies between 1,500 rupees to 3,000 rupees, depends on the city she is getting the treatment. So on an average, we can say that these three things are major headings for the expenses, and that comes to 10,000 rupees minimum to 25,000 rupees maximum. Depends on the pathology.
All right. Okay. So there must be certain cases where IUI is not working, right? So is there an upper limit of the cycles of IUI cycles which are recommended before considering any other option?
So, like, this is extremely good question, and for the rising population of career-oriented females and not getting married at the right age and not planning their first baby right before the age of 30, for them, this is like IUI is very much required, and I always advise that at least plan your first baby before the age of 30. Now, in those females, like, even if the tubes are functioning, uterus is proper, she is ovulating, but because her eggs are 30 years plus, like we have to go fast. And the number of the eggs which are like any female is born with in the ovary, they are fixed. And the gradually as age increases, that storage gets exhausted. So for all those females who are 30 plus, उनके लिए we usually all clinicians in India and like with the data of our own Indian population, max to max we advise them to go for IUI for 3 attempts, even if they are absolutely normal. We call them like unexplained infertility in most of the patients, and we advise them to go for 3 IUI. If by 3 IUI attempts, if they do not get the successful result, that is pregnancy, then we tell them that like your biological clock is all the time ticking, and go faster in the direction of having your own biological child. So in that case, after 3 IUI, if you do not get the success, we advise them to go ahead with IVF. So this is the one thing. Second, in those females who have one fallopian tube is blocked and one fallopian tube is functioning normally, usually 3 to 6 cycles of IUI, we usually get results. So we wait for 6 cycles of IUI. And if by 6 cycles they do not get the result, then only we advise them for IVF. Third group of the patients, in case semen parameters are borderline, or the husband has a progressive pathology, like जिसका semen का reports like ongoingly down जा रहा है, who is overexposed to smokes or radars or like certain things which are like these factors are very detrimental to the sperm's fertility. अगर ऐसा कोई है तो उसपे we advise them that like if you do not get the results by 3 cycles, if your pathology is like over a period of time it is getting more and more troublesome, then max we wait for the 3 cycles. If you do not get the result, then proceed further for IVF. And otherwise in IVF also, like we have to even like in the very last number of the sperms, active and fertile sperms, even in IVF also results are nearly half than in other cases of IVF, right? So very, very important that like max wait for the 3 cycles of IUI and then straight away proceed for IVF.
Thank you so much. It was wonderful having this conversation. I hope it will help all our viewers while choosing or opting for IUI.
I got that. Thank you very much. And I really appreciate you people doing this extraordinary work for the education of the people.
Thank you
seeking
so
for the
much.
fertility treatment. Yeah, for sure. Thank you. Bye-bye.
Thank you. Okay, bye.